According to the World Health Organization, over 34 million people worldwide are HIV positive. Each year, an estimated 2.5 million people are infected with the virus. More than 2/3 of new HIV infections occur in sub-Saharan Africa.
I had been in a relationship with somebody that I had known for 14 years, somebody that I trusted. So condoms were never discussed in that relationship. And it was a bit of a disappointment and shock to actually realize that you can never trust anyone when it comes to having unprotected sex. So I probably learned the hard way. Because of our gender, we are meant to be lesser than men. In some cultural settings, you can't challenge your husband. You can't challenge the man who's looking after you. So obviously I have no power. So there's already inequality in that relationship because this other person is more powerful than you. So I can't go and ask him to start using condoms.
Women represent more than half of the HIV-positive individuals worldwide. Bearing the specific issue in mind, a group of scientists is working together to find a way to make HIV infection prevention easier. They are part of a project called MOTIF. The project is formed by a consortium of 9 European organisations, among them laboratories, research centres and universities.
The main goal of the MOTIF project is to develop formulations of microbicides that are optimised to give the most appropriate levels of drug in tissues. And by most appropriate, I mean the levels of drug that will be able to prevent virus infection. King's College has 2 roles in the MOTIF project. One is coordination and the other is research on microbicides. So our particular task in MOTIF is to develop in vitro models of drug transport across the vaginal and rectal epithelial barriers.
The University of Aberdeen, along with the University of Siena and Microbiotech, main goal is to characterize drug transporters in cervicovaginal and colorectal tissue.
The role of Microbiotech in MOTIF Project is setting up the gene expression experiment on cell line derived from human genital tracts, both in physiological and treated conditions. These cells were treated with anti-HIV drugs or hormones or in presence of vaginal amines or with specific pathogens or probiotics.
Our role in the MOTIF project is to study the expression of gene encoding for the drug transporter in human tissue.
We try and model the way these antiretroviral drugs work to prevent HIV infection. So we've developed some models where we can take mucosal tissue from patients following therapeutic surgery, and we can grow that tissue in very small explants and look at how the drugs interact with the tissue in terms of safety, but also how they are working to prevent HIV infection. So to some extent, it's as near as we can get to actually testing them in a real-life challenge situation, because we're taking mucosal tissue and challenging it with the HIV virus in the laboratory and seeing whether the drugs work.
We contribute to the preclinical evaluation of the new compounds used as microbicides, and we are testing the combinations provided by the partners in non-human primates. We can use as model then for testing the compounds for pharmacology and efficacy.
The role of Meditox in the MOTIF project is to perform preclinical testing of antivirotics in rabbit models after vaginal and rectal administration.
The main benefit of MOTIF, I think, will be twofold. One is it should give us a better understanding of how drugs are distributed in the target tissues for HIV infection. And the other point is drug combinations have the advantage of countering possible resistance in virus strains, so they should be more effective, and they'll also present a higher barrier to the development of resistance to drugs in the virus. I hope that we would contribute to the development of an effective microbicide. HIV, as you know, is a huge problem, so something that prevents HIV and if it prevents it effectively would obviously have an enormous effect on large numbers of people.
The invention of a microbicide gel would mean that women would be able to take control of their sexual health and prevent themselves from contracting HIV from unprotected sex.